Introduction to Clinical Pharmacology, Chapter 31, Upper Respiratory System Drugs. Common conditions of the upper respiratory system include infections, allergic rhinitis, coughs, the common cold, and congestion. Antihistamines relieve allergy symptoms. Decongestants reduce nasal edema. Antitussives, mucolytics, and expectorants treat the accompanying cough. Actions of antihistamines. Antihistamines block most but not all of the effects of histamine. First-generation antihistamines bind non-selectively to central and peripheral H1 receptors, which may result in CNS stimulation or depression. Other first-generation drugs may have additional effects, antipyretic or anti-itching, or antiemetic or anti-nausea effects. Second-generation antihistamines are selective for peripheral H1 receptors and, as a group, are less sedating. Antihistamine uses. The general use of antihistamines includes relief of seasonal and perennial allergies, relief of allergic and vasomotor rhinitis, relief of allergic conjunctivitis, relief of mild and uncomplicated angioneurotic edema and urticaria, relief of allergic reactions to drugs, blood, or plasma, relief of coughs caused by colds or allergies, adjunctive therapy in anaphylactic shock, treatment of Parkinsonism, relief of nausea and vomiting, relief of motion sickness, sedation, and adjuncts to analgesics. Adverse reactions of antihistamines. Central nervous system reactions occur, such as drowsiness or sedation and disturbed coordination. Anticholinergic effects include dryness of the mouth, the nose, and the throat, thickening of bronchial secretions. So it has a drying effect, the anticholinergic. Antihistamines, contraindications and precautions. Antihistamines are contraindicated during pregnancy and lactation. First-generation antihistamines. Patients with known hypersensitivity to the drugs, newborns, premature infants, nursing mothers, individuals undergoing MAO therapy, and patients with angle closure glaucoma, stenosing peptic ulcers, symptomatic prostatic hypertrophy, and bladder neck obstruction should all not take antihistamines or use precaution at the least. Contraindications and precautions for second-generation antihistamines include patients with a known hypersensitivity. Cetirizine is contraindicated in patients hypersensitive to hydroxine. Second-generation antihistamines should be used in caution in patients with bronchial asthma, cardiovascular disease, narrow-angle glaucoma, symptomatic prostatic hypertrophy, hypertension, impaired kidney function, peptic ulcer, urinary retention, pyloroduodenal obstruction, and hyperthyroidism. Antihistamines and their interactions. Review the following chart for interactions that occur with antihistamines and these specific drugs. Assessment. Prior to administration. The assessment the nurse may perform. Assess the eyes, nose, upper and lower respiratory tract. If the patient is receiving an antihistamine for relief of allergy symptoms. Looking at these areas will help you determine if the antihistamine is effective. If promethazine or phenergen is used with an opioid to enhance the effects and reduce the dosage of the opioid, be sure to take the patient's blood pressure, pulse, and respiratory rate before administering the drug. Ongoing assessment. Observe the patient for the expected effects of the antihistamine and for adverse reactions. Antihistamine is given for a serious situation. Assess the patient at frequent intervals until symptoms appear relieved and for about 24 hours after the incident. Plan. The expected outcomes for the patient depend on the reason for administration of the antihistamine, but may include optimal response to therapy, support of patient needs related to managing adverse reactions, understanding and compliance with the prescribed treatment regimen. Implementation. Promote an optimal response to therapy. Antihistamines are given orally to prevent GI upset. Loratadine can be administered with or without water and can be placed directly on the tongue where it dissolves instantly. Fexofenadine is not administered within 2 hours of antacids, and antihistamines that are administered parenterally should be given deep IM rather than sub-Q. Monitoring and managing patient needs. Impaired oral mucous membranes, dryness of the mouth, nose, and throat. Offer the patient frequent sips of water or ice chips to help relieve the symptoms. Risk of injury. Assist the patient with ambulation. Place the call light within easy reach and instruct the patient to call before attempting to get out of bed and ambulating. Remember, many of the antihistamines have a sedative effect and also can affect the central nervous system. Educating the patient and the family. Review the dosage regimen and possible adverse drug reactions with the patient. Evaluation. Evaluate mucous membranes to ensure they are moist and intact, no injury is reported, and that the patient and family understand the drug regimen and any possible reactions. Decongestants. Nasal decongestants act by reducing edema in the nasal area. Sympathomimetic drugs produce localized vasoconstriction of the small blood vessels of the nasal membranes. They're used to treat congestion associated with the following conditions: common colds, hay fever, sinusitis, allergic rhinitis, congestion associated with rhinitis. Adverse reactions and contraindications for decongestants. Use of oral decongestants may result in the following adverse reactions: tachycardia and other cardiac arrhythmias, nervousness, restlessness, insomnia, blurred vision, nausea, and vomiting. They are contraindicated in patients with known hypersensitivity and patients taking MAO inhibitors. Sustained-release pseudoephedrine is contraindicated in children younger than 12 years of age. Precautions. Decongestants are used cautiously in patients with thyroid disease, diabetes, cardiovascular disease, prostate hypertrophy, coronary artery disease, peripheral vascular disease, hypertension, and glaucoma. Pregnant women should also consult with their primary healthcare provider prior to using these drugs. So, interactions of decongestants. You really want to pay close attention to the MAOI inhibitors. These can create a hypertensive crisis when taken with the decongestant. The patient will first present with severe headache and hypertension and then possibly go into a hypertensive crisis. Beta-adrenergic blocking drugs or beta blockers. The initial hypertension, initially they may have a hypertensive episode followed by bradycardia. Antitussives, expectorants, and mucolytics. Actions and using. Expectorants increase the production of respiratory secretions, which in turn appears to decrease the viscosity of the mucus. This helps raise secretions from the respiratory passages. Antitussives are used to relieve a non-productive cough. Expectorants are used to help bring up respiratory secretions. You will see test questions regarding these medications. Adverse reactions of antitussives, expectorants, and mucolytics include lightheadedness, dizziness, and drowsiness or sedation. Prior to administration, assess the patient's blood pressure, pulse, and congestion. Assess the lung sounds, bronchial secretions, and note in the patient's record. Obtain the history and the use of the products. This pre-assessment will help you determine the patient's baseline status and determine if the medication is effective or not. Ongoing assessment. Assess the patient's blood pressure, pulse, and congestion. Question the patient about attaining therapeutic effects, the presence of adverse reactions. Risk for injury. Related to drowsiness, dizziness, or sedation. Ineffective airway clearance. Related to pooling of or thick secretions. Impaired oral mucous membranes. Related to dry mouth, nose, and throat. Planning. Expected outcome for the patient includes an optimal response to therapy, support of patient needs related to management of adverse reactions, understanding of and compliance with the prescribed treatment regimen. Promote an optimal response to therapy. Ineffective breathing pattern. Overuse of the topical form. Rebound nasal congestion. The patient is taught to take the drug exactly as prescribed or discontinue drug therapy gradually. Remember, we talked about some patients who have shortness of breath and respiratory difficulties, and they may overuse these decongestants and other forms of treatment for allergies in order to thinking that if they take more, it will be better. But actually, taking more can cause rebound effects of these medications and other issues. Educating the patient and the family. The nurse should include the following points in the teaching plan. Use this product as directed by the physician or on the container label. Understand that overuse of topical nasal decongestants can make symptoms worse, causing rebound congestion. If using a spray, do not allow the tip of the container to touch the nasal mucosa and do not share the container with anyone. Finally, we want to evaluate our patient. The patient should maintain an effective breathing pattern. The therapeutic effect should be achieved, and the patient should demonstrate an understanding of and compliance with the drug regimen. Question: is the following statement true or false? Cough, cold, congestion, and allergies are common problems in the upper respiratory system. True. Cough, cold, congestion, and allergies are common problems in the upper respiratory system. Is the following statement true or false? Expectorants or mucolytics are used to reduce inflammation. False. Antihistamines are used to reduce inflammation. Decongestants reduce edema and swelling. Antitussives are used to eliminate cough. When congestion produces secretions in either respiratory passages or lungs, expectorants or mucolytics are used respectively. You will see test questions regarding this information.